I'm Sheldon McLeod. Welcome back to the SaltWire Network. And this is Thinking Out Loud. And thank you very much for joining us on all the platforms. And I'm a political watcher, and I know many of you are as well. And last night, just after watching the late news, or in the middle of the late news, I saw the news release come out that the spring legislative session has wrapped up. This was released from the Premier's office at around 10:30 on the 12th of April. The historic investment to improve healthcare, new legislation to get more Nova Scotians faster access to care, highlights of the spring legislative session that closed April 12th. And it was a short session. And according to the official opposition, it was a session that was short on other things. And Zach Churchill is the leader of His Majesty's Loyal Opposition. He joins us from his office in Halifax today. Zach Churchill, thank you for doing this.
Hi, Sheldon. Thanks for having me back on.
When you talk about short on ideas to get through some of the challenges people are facing, how did you rate this session, this spring session in 2023?
Well, I have big problems with the budget that they brought forward. You know, this is a budget that I do not think is going to improve our healthcare systems in the way that we need to. There is not money in there to incentivize family doctors to practice in family medicine or to attach patients to family medicine. The biggest line item new to healthcare is on a 2-year retention bonus for nurses, which is good. You know, we've been bleeding out nurses and other healthcare staff from our system, but this is not a long-term plan. What's going to happen after 2 years? There's nothing there to recruit new employees. And we've also heard from the folks that didn't receive the bonus that they're also unhappy about it. So, I mean, that's the big signature expense in this budget. I don't think it's long-term thinking. I hopefully it helps right now keep people in the system and help them feel valued. That's important. But we have heard from a lot of people that didn't receive it and now don't feel valued. Also, if you look at this budget, when it comes to some of the root causes of health problems in our province, which obviously contribute to the healthcare pressures we have, there's nothing in there that's going to help people in meaningful ways to help them be healthier. In fact, I think there's elements in this budget that are going to make people sicker in this province. They have frozen income assistance for 2 years in a row now when inflation is shooting through the roof. There's nothing in there to address the growing food insecurity problem that we have in Nova Scotia. And they also increased the income criteria for receiving rent supplements. These are the, support to help people deal with and pay for their rent. Now you have to be paying 50% of your income on rent to even be eligible for a rent supplement. So these are real problems because housing, food, and income are the 3 biggest factors that impact people's health and well-being. And if you talk to doctors, they're going to tell you the vast majority of acute healthcare cases in our hospitals right now, they're related to those 3 issues: income, access to quality food, and access to appropriate shelter. And the fact that they have not even have they not addressed these issues, but their budget, I think, is going to make things worse, is going to, over the next couple of years, I think, make the challenges in our healthcare system worse as well, and make life more challenging for people, and maybe contribute to higher levels of certain illnesses and challenges. So we brought forward some ideas this session to actually address the root causes of a lot of our healthcare challenges, and that's people's health, to make sure that income assistance, so assistance for those that are most financially vulnerable, is actually indexed to inflation. We brought forward a piece of legislation to bring in a universal school lunch program that can provide healthy lunch to all of the kids and older students in our schools, no matter where they come from, and also to index taxes to inflation as well, so that when inflation goes up, you're not losing all your buying power, right? Because it's not just those on the lower income side of things that are struggling right now. There's a lot of middle income people that are really struggling to make ends meet during this inflationary period.
We're 19 months into a majority progressive conservative government, as noted, and I want to hear your thoughts directly about this Patient Access to Care Act. The government says this is a solution for healthcare. And how does Zach Churchill feel about that legislation?
Well, listen, in terms of the intent to expand scope of practice for medical professionals, that is needed. That's a good thing. People need to be practicing to their full scope. Where we're worried about this legislation is that it takes all of the power from the medical professionals who self-regulate those professions and puts it into the hands of the provincial cabinet. So you've got now politics coming in to making decisions instead of patient safety. So those colleges are really important. Like these are the groups that regulate doctors, physiotherapists, pharmacists, all these people. They really care about patient safety. So, someone can't come and practice in Nova Scotia if they don't have the appropriate level of training, or if they come from a context where the medical culture is different, particularly around abortion and mental health and addictions. Like medicine isn't taught the same everywhere in the world. The cultures around medicine aren't the same everywhere in the world. And those colleges do provide a protective layer to patients to make sure that the doctors and healthcare professionals coming here are going to be able to provide high quality care. So we think there's some risks there, and that's coming from the doctors and other healthcare professionals themselves. We brought some amendments in line with what the healthcare experts were saying, and they were all disregarded by the government. So listen, we think people need to practice more. We need more doctors here. People need to have a broader scope, but we can't sacrifice patient safety in our kind of rash pursuit of those things, right? And that really matters, right? Like if you're dealing with an anesthetist or a surgeon or a doctor, there's a lot of life and death situations that those people, are overseeing, and you want to have the very best, and you want to get the highest quality care possible. So that is one major risk that we see with that legislation. Why do you want the politicians in charge of that, or do you want the medical professionals in charge of that, right? The political incentives aren't always the same as the medical and patient safety incentives. So we think that's a risk.
You and others have said pocketbook issues are the most important. There's criticism there of the government in this budget and not perhaps addressing some of that. We'll go back in time to when it was an opposition Liberals in 2014, and it was a concern over tax on tax. And then in government for 8 years, that didn't change. I'm talking specifically about motor fuels. And I know there was some pushback saying that this provincial government could have done something about the excise tax on fuel and gasoline that didn't. Tell me where you think that should go, and whether or not people recognize, you served as finance minister in that capacity for a while, the idea that it could be a little less expensive for us if something like that was addressed, the tax on tax when it comes to the motor fuel tax and the HST.
Yeah, I never had the privilege of being finance minister. A job back then I would have loved to have, but we are in a very different context right now. We in the last 8 years, there wasn't high inflation. There wasn't a labor shortage. There was a big provincial deficit that needed to be dealt with. And the context is very different now. We've got inflation shooting through the roof. We've got labor shortages, and we've got growing problems around food insecurity, homelessness for the first time. Like we have the highest homelessness rates that we've ever had in our province's history, and a major housing crisis. So these are new challenges, that are here, and we have to have new ideas to deal with them. Affordability actually impacts people's health. We know that people who are food insecure are 50% less likely to actually go get their prescription medications. Right? What's going to happen to those people? They're going to get sicker. They're going to show up in our emergency rooms with more acute illnesses and severity of symptoms. We know that people that don't have housing or that are stressed out about the affordability of their housing have higher levels of depression and anxiety and mental illness. And we know that financial insecurity is linked to a whole host of problems, in particular, depression, anxiety, and stomach ulcers and all kinds of other things, right? So we have to look at these affordability pressures, the cost of living pressures, through a health lens. And this government is not doing that. They're trying to throw Band-Aids on a growing problem in our healthcare system. And those Band-Aids aren't working either, by the way. Things are getting worse pretty drastically. And also, they're not going after some of these root problems, which is in Nova Scotia, people's health. We've got a sick population compared to other provinces. We have an aging population. So if we're not paying attention to the factors that affect people's health and well-being, we are going to have more problems in our hospitals, and our doctors, our nurses, our medical staff are going to continually deal with more pressures, and we're going to be chasing our tail on this thing.
And thank you for the correction. I know it was health. I know it was education. I thought at one point you briefly were interim finance, but again, thank you for the correction. But to the point about education, and close to 5,600 school sport workers are in a position where they have voted to strike if they don't get a better deal. What's your assessment of that situation, and what will happen or could happen next week?
Well, that's going to create a big problem for kids, for students, and for parents. Like, that's going to impact the availability of pre-primary, which is, that is a program that I did bring in as education minister. That's critical to working families, right, that have 4-year-olds. Like, that is free early learning and childcare. So if they're without that, I know that creates problems. We have that problem in our household if school shut down, for a day. Both myself and my wife work, and that's going to create a major problem for working families trying to find spaces for their kids. We know that daycares are also over capacity right now as well. So this is going to create some major problems for people. And I do think that the government has a responsibility to make sure that strike does not happen. We've heard that the offer has been, an increase of 26 cents on the hour for these workers. That's obviously not enough. Like, we are in a heightened inflationary period, and that does have to factor into labor negotiations as well.
And to that point, the union rep that I spoke with said they felt that they haven't been able to keep up, that wages are not where they should be. Clearly, that was something that you may or may not have been able to impact or influence. What do you know about why those folks who are helping the kids in the classroom in that way have not seen the same types of gains in wage that other sectors have?
Well, when we were in government, certainly everybody in the public sector had the same wage pattern. It was consistent across the board. But I think what these folks are dealing with now is the lowering of their buying power. Every dollar somebody makes now is worth 20% less than it was a few years ago. So, inflation went up last year close to 10%. I believe it was around the same the year before. So every single person, their money is worth less now. They can get less with their money, and that's creating a lot of pressure on people. And like I said, not just folks that are on the lower side of the income spectrum, but a lot of middle class working families are dealing with this too. They're having a hard time paying for their rents, and anybody who's not under the rent cap, anybody new to the rental market, their rents have been shooting through the roof. People are spending, over 20% more at the grocery store now. Food's very expensive, and this is putting a lot of pressure on people. And the government, provincial government, actually has a responsibility, I think, to help during this period. Cutting the gas tax, we said, would be temporary to help put money back in people's pockets. We also brought forward a piece of legislation to lower income tax rates, taking into consideration what inflation is doing to people, to keep more money in people's pockets. We brought in legislation to bring in a lunch program so that all families who have kids in school, they know their kids are going to have access to a good lunch, which is important for people's health and the learning environment. And we've also pitched the idea and brought legislation to cover continuous glucose monitoring pumps for those on diabetes. We've got over 112,000 people in Nova Scotia suffering from type 1 and type 2 diabetes. A lot of those folks need continuous glucose monitors, and they're not covered. So that's another cost for these folks just to keep up with their health maintenance, And if we're going to fix healthcare again, all these factors matter. We're not going to fix healthcare in Nova Scotia till we actually start paying attention to people's health and helping them be healthier. Folks with diabetes are susceptible to all kinds of more problematic illnesses, cardiovascular, losing limbs, a whole host of things, right? Dementia, Alzheimer's. So helping on the preventative side of things from a healthcare perspective is really important, but also helping on the affordability and financial and food security and housing side is absolutely critical if we're going to get anywhere with health and healthcare in Nova Scotia.
Last question. You're the representative for Yarmouth. The Nova Scotia to Maine Ferry has been a political football for the last number of years. Opposition Tim Houston was very critical. The government has announced a review. What is Zach Churchill's assessment of what this premier has learned about the ferry service and what your thoughts are about what he now may be thinking about this?
Well, obviously, everybody who's involved in tourism in Nova Scotia, not just from the Yarmouth and Acadian Shores area, is worried about this. There's been a ferry in Yarmouth for 150 years, except when the NDP cut it and when COVID shut it down for a couple of years. And it brings in tens of millions of dollars into our economy. We are a province that's surrounded by water. We've got 13 ferries in Nova Scotia. They're all subsidized. They're all considered to be loss leaders, which means you put money in because you get either an economic or social benefit out of it. The subsidy for the International Ferry Link in Yarmouth is on par with the one that goes to New Brunswick, the ones that go to Pictou, and I feel it's been treated unfairly. For the Halifax audience, the ferry that goes back and forth in the harbor is subsidized $5 million a year. We've got one in Yarmouth that connects us to one of the biggest tourism markets in the world that's subsidized about $15 million a year. It's not a major expense. And last year, the tourism sector indicated that ferry probably brought in $40 million into the tourism economy. So there is a massive return on it. I think it's unfair that it's the only ferry that's been targeted in this way. It's been politics. It hasn't been economics that have driven the issues around that service. And I just hope that the Premier and the Cabinet understand the importance. I hope that if they are going to target this with an economic study, that it can put this issue to bed, and that it's done fairly. If you look at the return on investment to the province, I think that story will win every time. If you're looking at the economics of the ferry itself and whether it's ever going to make money, no ferries in the country do. So you have to look at the economic return, not the return on the ferry service itself. So hopefully they have the right lens on this. Hopefully they listen to those that know this file and know the economic impact, and hopefully we can just move beyond this. Because listen, the Yarmouth and Acadian Shores had the highest increase in room accommodation, in room bookings, like last year in the whole province. The ferry, the market for the ferry actually recovered more quickly than driving traffic into Ontario from the United States, and recovered more quickly than ferry traffic that returned into to British Columbia. So it is an extremely valuable connection economically for our province and for the Western region mostly. But people are traveling all the way to Halifax and Cape Breton. They come off of that boat. They spend twice as much time here and spend twice as much money as other visitors. So we hope they understand that, and he's going to have enough political fires on his plate. I don't think he needs another one on this one.
Leader of Nova Scotia's Liberal Party, Zach Churchill, thank you again.
Thank you very much for your time, Sheldon. Always appreciate chatting with you.